My name is Benjamin Sims. I'm a clinical lead and a first contact practitioner for physio for GPs. My base is Northgate surgery. So like many kids at 18, I ain't got a clue what I wanted to do. When I finished school, did my basic GCSEs and A-levels. I was quite sporty and active, so I went on and did a sports science degree. Qualified out of that at 21. It gave me no further inclination as to what I wanted to do. So essentially I went travelling for 7 years, and that was to delay that decision even longer. I applied for physio at about 28 onto a master's course in Essex. And I was living up in Essex, and a role come up in Kent in a community hospital as a physio. So I took that on a bit of a whim. There was nothing else in the country. And a couple of weeks later, a part-time musculo-skeletal physio role came up actually in this surgery, in this room. And this was about 14 years ago, and it was a little evening shift. And essentially that's where my career started in primary care. Since then, between kind of 31 and now, which is about 13 years, loads and loads has happened in my career and also in primary care. So the first couple of years of working in primary care as a musculo-skeletal physio, I essentially was learning the bread and butter of physio, reinforcing my knowledge from university and applying it to get patients better. Because essentially what I took out of those 2 years with all the patients that I saw were particular patterns that I picked up from practice. And the most obvious theme was I felt that we were treating patients quite simplistically. And what I mean by that is that we were treating them for a physical condition like physios should. However, a high percentage of patients were coming in with physical pain, but there was a psychosocial element or a psychological element which may be driving or contributing to their physical symptoms. It kind of set me down a bit of a learning path and a change in my career. I always kept my foot in primary care, but I felt that I needed some more stimulation and some additional learning to explore this pattern and also to make my practice more holistic so I could deal with these patients better as they come through the door and make their experience more holistic, because I felt it was too simplistic. So at the time I was subcontracting for another firm who had the contract in this surgery. So I did a cognitive behavioral therapy course to capture those patients that I couldn't work out in my normal practice. I did a acupuncture and injection course, and then a couple of years later I did a master's in leadership and a master's in advanced communication. And I think if you look at those kind of learning strategies, it's no surprise that today I am where I am, managing a team of about 12 physios. And I went and did some case management with spinal cord injured patients. I did some expert witness cases, so litigation cases, defending physios. I did a bit of work in an intermediate care team to see how things worked in secondary care. Probably about 6 years ago, I went through a period of change, some personal change, and some adversity, some self-development and self-awareness, and all of that experience before, but also that period in my life, that personal change period, that actually encouraged me and gave me the confidence to take up a contract in a GP practice, which was this one here. And I employed a couple of physios to help me run the contract, and then 5 or 6 years later we've got 11 or 12 physios working for us, and we've got multiple physio contracts in GP practices. Now my role is managing the team. I do a little bit of clinical stuff, I do a few injections, things like that, but it's essentially managing the team. I'd say three things. Number one, curiosity in people. Always interested in people's behavior, how we can manipulate behavior and performance, and physiotherapy in primary care gave me that opportunity to do that, and continues to do that. So yeah, curiosity of people and maintaining that is massively important if you want to work in primary care. Number two, the flexibility and the autonomy. When I came into primary care when I was 30 odd, essentially I was coming straight into a self-employed role. I liked that. I was my own boss, even though I was subcontracting for someone else. I had the ability to kind of float in and out of the hours that I wanted to do. Most of my staff only work a 4-day week to maintain that working life balance, and I really encourage that. And essentially they can work flexi hours as long as they get their hours done. Happy days to them. Lastly, why did I come into primary care? I think at the time I was pretty strapped cash wise. I've been traveling for a long time, and it's a competitive wage. You know, you get you're working for private firms in the NHS. You get things done essentially, and with that you get paid a higher wage. So that was definitely attractive. Like I said, I'm not doing too much clinical stuff. So although the patients I do get, they'll tend to be kind of complex patients where some of the junior staff will need a second opinion. So that will maybe complex neurological patients or psychosocial patients, chronic-y type of patients. They're the ones that I'll generally see. The patients I will see also are injection patients. So if they need a shoulder, knee, hip or elbow injection, that's the type of stuff I'll do. The role, in some days I'm blessed because I've got a lot of time off and I am just checking in with clinics, checking in with staff, training staff, maintaining maintaining a happy team and keeping the team lubricated and keeping it ticking over. Some days are stressful if you need to cover a clinic, if you've got staff sickness, if you're bidding for a contract and you need to knuckle down. But at the moment the balance is pretty good. It's a private provider, but essentially what that means is that the plus to that is that we bring high paid, which means top class physios into the practice, which reduces waiting lists. They operate at high levels, they make high-end decisions. So what we're doing is we're delivering a seamless service, not just to the practice but to our patient population. In terms of how it personally impacts the GPs, what we've set up is a first contact practitioner service, which has gathered a lot of traction over the last couple of years. We set it up about 4 years ago here, I think, something like that. And what that does is capture about 33% of patients walking through that front door who are musculo-skeletal in nature, so they will see a physio, an FCP physio, before they see the GP. So it frees up GP time, allows the GP to crack on with the medical side of things, while we can capture that specialist group, and then that will reduce the waiting list. It reduces further onward costs to secondary care. I'm really proud of the team that I have, and that's the first and foremost is maintaining a solid, happy team, and once you've got that foundation, then your customer base, your patient base, that will come naturally. I'm at that stage now where I've got some core members who have been with me 4 or 5 years, and some junior members coming through as well. And so to see that team grow has been incredible. I really enjoy that, and I want to maintain that. So to maintain the team is the most important thing. My dream would be to kind of expand out of Kent, and however, workforce shortages may kind of determine that, and that's a difficulty to be able to do that. But I would like to spread my knowledge and experience further outside Kent. Lastly, on a personal kind of mission, I think is continuing to self-develop. I want to do a TED talk in the next year or so on kind of psychosocial factors in health, business mentorship with a group of disadvantaged kids in Wales, which is really cool. And that's something that I've learned on the back of the last 5 or 6 years of management and business in health. So hopefully being able to give back in business in a disadvantaged area.